Thank you, and welcome to the second installment of the monthly series, Who's Leading the Leading Health Indicators? Each month, this series will highlight an organization that is using evidence-based approaches to address one of the Healthy People 2020 Leading Health Indicator topics. Our launch on January 25th focused on access to health services and will be archived on the healthypeople.gov website. This month, we're focusing on injuries and violence. During today's webinar, you will hear from 5 distinguished speakers. First, Assistant Secretary for Health, Dr. Howard Koh, will introduce this month's LHI topic, injury and violence. Next, Health and Human Services Regional Health Administrator of Region 3, Dalton Paxman, will give a snapshot of injury and violence prevention activities in HHS Region 3. Then, this month's featured organization, Philadelphia Land Care Program, and Robert Grossman will discuss how their program is addressing injury and violence using a determinants of health approach in communities. And finally, Dr. Charles Brannis will discuss the University of Pennsylvania's collaboration with the Philadelphia Land Care Program to determine the program's impact on injury and violence. Next slide. For those of you who are new to this series and to Healthy People in general, let me give you some background on Healthy People, the initiative that introduced the leading health indicators. For 4 decades, Healthy People has provided a comprehensive set of national 10-year objectives that have served as a framework for public health activities at all levels and across the public health community. The Healthy People Initiative has evolved as the nation's public health priorities have changed. Often called a roadmap for national health promotion and disease prevention efforts, Healthy People is about understanding where we are now and taking informed actions to get where we want to be by the end of the decade. Next slide. You may ask, what are the leading health indicators? The leading health indicators represent critical health issues that, if addressed appropriately, will dramatically reduce the leading causes of preventable death and illness. These indicators, or critical health issues, are linked to specific Healthy People objectives. They have been selected to communicate high-priority health issues to the public, along with the actions that can be taken to address them, with the overall goal of improving the health of the entire population. Next slide. Great strides have been made over the past decade. Life expectancy at birth increased, rates of death from coronary heart disease and stroke decreased, and yet that said, public health challenges remain and significant health disparities persist. The Healthy People 2020 Leading Health Indicators place renewed emphasis on the overcoming these challenges as we track progress over the course of the decade. The indicators will be used to assess the health of the nation, to facilitate collaboration across sectors, and to motivate action at the national, state, and community levels to improve the health of the U.S. population. At this time, I'd like to turn the podium over to Dr. Howard Koh.
Thank you so much, Dr. Wright, for your leadership. Thank you to my wonderful colleagues at the Office of Disease Prevention and Health Promotion for launching this series, and many thanks to all of you who are joining us for this webinar. In my couple of minutes, let me start by giving you a brief overview on this month's LHI topic, injury and violence. Reducing injury and violence decreases disabilities and saves lives, and that's why it's a priority for our country for the next decade and beyond. Americans are susceptible to injury and violence across their lifespan, and we're concerned about injury and violence because they rank among the top 15 killers of Americans of all ages, and it also ranks as a leading cause of death for ages 1 to 44. We should also note that injury and violence contribute to increased morbidity related to disability, poor mental health, and increasing medical costs. Next slide, please. We can point to numerous determinants or factors that affect the risk of injury and violence, and these determinants are personal, social, economic, or environmental, among an array of causes. So, for example, individual behavior such as alcohol use or risk-taking increase injuries. Access to services can affect rates of injury and violence. For example, injury-related care can reduce the consequences of injury and violence. And then physical environment is very important in affecting rates of injury and violence, and that's why today we are focusing on the Philadelphia Land Care Program, an example of the determinants of health approach at work in affecting people's health. Next slide. For the leading health indicator of injury and violence, there are two outcomes that we are focusing on: fatal injuries and homicides. And to improve outcomes for these two indicators, we need action both at the individual and community level. With respect to the community level, we are promoting and focusing on actions at this broader level because it creates momentum for national change. And again, that's why we picked the Philadelphia Land Care Program as a wonderful example. Before we introduce that program, in the next few slides, let me review where we are as a nation with respect to these two important indicators, that is, fatal injuries and homicides. Next slide. This slide summarizes the injury death rate over the last decade, and you can see from 1999 to 2007, the death rate from all injuries increased by about 11%. But since 2007, the year the Healthy People 2020 baseline was set, the rate has decreased slightly, moving toward the ultimate Healthy People target of some 53.3 deaths per 100,000 population. Next slide. When you break down these injury deaths by gender, there's a very striking disparity by gender. Females have a much lower injury death rate than males, and you can see this across the past decade. In fact, the rate of males was about 2.5 times the rate for females. Next slide, please. And then regarding the other important indicator outcome, homicide rates, you can see that the homicide rate did not change significantly between 1999 and 2008, although there has been some decline between 2008 and 2009. And we need much more data now going forward to see if that slight decline is enough to turn into a continuing downward trend. Next slide. When you break down the homicide rate by race and ethnicity, again, you see some very striking disparities. The rate for the black non-Hispanic population is 8.5 times that of the group with the lowest rate, Asian or Pacific Islander. As another example of disparities by race and ethnicity, the rate for American Indians or Alaskan Native population was more than 3 times the group with the lowest rate, again, the Asian or Pacific Islander group. Also, comparing Hispanic or Latino populations with Asian Americans or Pacific Islanders, there's a threefold increase in terms of homicide rates. We look at slides like this and others to stress again that one of the major overarching goals for Healthy People 2020 is to eliminate disparities and improve the health of all populations moving forward. Next slide. So this is the final slide that I'm presenting before I turn it over to Dr. Paxman, but we have many initiatives with respect to the department promoting prevention of injury and violence over this next decade and beyond. So, for example, February is Teen Violence Awareness Month. We want to raise knowledge and awareness about the end results of abuse in youth relationships. We have an HHS action plan to reduce racial and ethnic disparities. Our goal here is to improve the health of underserved communities. We have a health reform law that will be celebrating its 2nd anniversary next month. Part of that required a national prevention strategy to be put forward, and that strategy prioritizes injury and violence and makes recommendations about community safety. And another very important provision coming out of the health reform law is that there will be now insurance coverage for domestic violence screening for women. An estimated 25% of women in the United States report being targets of intimate partner violence during their lifetimes. So this new provision that will start later on this year is a very important step forward with respect to prevention and public health.